If you ever struggle to understand the branches of aortic arch or confused of great vessels, this video is for you. So today we're going to simplify the great vessels of the heart using clear explanations that makes it easy to understand and remember. What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is the first time you're seeing this channel, don't forget to subscribe. Alright folks, let's talk about them. We're not discussing about the heart, but it's always nice to go back to square one, and this is what we want to discuss want to start from scratch. Remember that the heart has got two sides. We have the right side of the heart and the left side, and the general rule is the right side of the heart is receiving deoxygenated blood, and then it pumps the blood into the lungs, and then the left side of the heart is receiving oxygenated blood, and then it pumps this blood to the rest of the body for the supply. So we have the left side of the body and right side of the body, and that's a general rule. But what's the difference between arteries and vein? We said the arteries will carry blood away from the heart, and then the veins will carry blood into the heart. The vessels that will carry blood into the heart are called veins, and the vessels that are carrying blood outside of the heart, outside from the heart into the rest of the body for circulation, are called veins. What's the difference between artery and aorta? We already discussed this one when doing the elements of angiology, but the aorta is considered the biggest arteries because arteries have got scales depending on the diameter, on the caliber of the calibers. They're divided into those scales. Going back again to square one, you said the veins or arteries will carry oxygenated blood, with the exception of two arteries which are called the pulmonary arteries. The pulmonary arteries will carry deoxygenated blood into the lungs. Also, we said all veins will carry deoxygenated blood into the heart, with the exception of pulmonary veins which carry oxygenated blood into the heart. We have different stories when it comes to fetal circulation, because this is totally different in fetal circulation. We discuss about fetal circulation at some point, but for today let's go with that flow. If I'm chopping out, so this is the heart which was here, so I'm taking out the heart to see the vessels, to see the orientation of the vessels. So assuming this was, it can be put back here. So we have major vessels of the heart. We have said we have veins and arteries. Starting with the veins, the biggest vein that is draining the biggest veins are called vena cava. So we have two vena cava, and the word vena cava is actually coming from ancient Greek. Is ancient Latin. Vena means vein, but cava means hollow. This means the vena cava means hollow vein. Why is it called hollow vein? Because it's very huge. So meaning it is called hollow to signify its huge size. In the human body, we have two main vena cava, two great veins, which are called vena cava. We have superior vena cava, but because this is superior, we should also have inferior vena cava. This is inferior vena cava. But what's the function of veins? Veins, they drain blood into the heart. So we have the superior vena cava and inferior vena cava. Superior vena cava is draining blood from the upper part of the body, but the inferior vena cava is draining blood from the lower parts of the body. But we also have the pulmonary circulation between the heart and the lungs, called pulmonary circulation. We discussed about pulmonary circulation at some point, but what are the veins that are carrying blood from the lungs into the heart? These veins are called pulmonary veins, and as we've said, the pulmonary veins will carry oxygenated blood into the heart, and the rest of the veins will carry deoxygenated deoxygenated blood. But because we have the pulmonary veins, we also have pulmonary arteries. So the pulmonary arteries will carry blood from the heart into the lungs in what we say pulmonary circulation. We'll talk about pulmonary circulation at some point, but the arteries that are carrying blood into the lungs are called pulmonary arteries. But pulmonary arteries will carry deoxygenated blood, unlike the rest of the arteries. They will carry deoxygenated blood. And then we have two pulmonary arteries, but they arise as a single artery. They arise as a single artery. This one, and this is what we call the pulmonary trunk. So the pulmonary trunk is the one which is arising from the heart, and then it branches into two arteries which are called the pulmonary arteries, right and left. We have seen we have four pulmonary veins. Two on the right side, two on the left side, or two are superior, two are inferior, four of them. But we only have two pulmonary arteries, one on the right, and one on the left. What's another artery that is coming from the heart? This one is called aorta. This is called aorta, right? So far we have seen this is aorta. This is aorta coming from the heart into the supplying this part of it. But this is pulmonary trunk. Pulmonary trunk it arises as a single artery, which is called the trunk, because the trunk means big. Remember, you discussed the elements of myology, elements of angiology, that the scales of arterioles, arteries, trunk, and aorta, right? Aorta. So far we have seen that we have two vena cava, superior and inferior vena cava, but we've also seen that we have four pulmonary veins that are draining blood into the heart, but the blood that is carried is oxygenated blood. But we've seen we have the pulmonary trunk, which we later divide to form two pulmonary arteries, one on the left, one on the right, and then we've seen also aorta, that is aorta. Okay, the blue parts, the blue vessels, they signify that they carry deoxygenated blood, but the red vessels, they signify that they carry oxygenated blood. Let's talk about the aorta. This is the aorta, and the word aorta comes from ancient Latin meaning to rise. So this artery is actually arising from the heart, and this is why it is called aorta. Aorta is the biggest artery. Is called aorta. But why does it give this impression of rising? Because it's the only artery that is the only biggest artery that is carrying blood from the heart into the rest of the body, and this gives impression of arising. So it arises from the heart, it supplies the rest of the body. The aorta has got three parts. It has got three parts. Some books they say that it has got four parts. Some they mention even two parts. But we see what makes the difference. The very first part, which is arising from the heart, is called because it's ascending. It gives an impression of ascending, so it is called ascending aorta. So ascending aorta, the very first part of the aorta, and then we have a curve here. It is curved here, and this curve is called aortic arch. Aortic arch, or also called the arc of aorta. But we discussed about the arc of aorta at some point we mentioned it when we were doing the sternum. We said at the sternal angle of Louis we have a lot of events that are happening, but one of the events is the arching of aorta. The curving of aorta is called aortic arch, and it happens at the level of the sternal angle of Louis. But we had ascending aorta here. Because of ascending aorta, we also have the descending aorta. So the first part, the third part of the aorta is called descending aorta. The descending aorta is also called the thoracic aorta. If at any moment you heard someone say thoracic aorta, they mean descending aorta. And if we heard someone saying descending aorta, they also mean the thoracic aorta. So these two words are used synonymously. And they refer to the same thing. The thoracic aorta, or the so-called descending aorta, when it punches the diaphragm at the level of T12, it punches the diaphragm at the level of T12, it changes from a thoracic aorta into abdominal aorta, right? It comes from thoracic aorta into abdominal aorta once it punches the diaphragm at the level of T12. And for this reason, some books will include the abdominal aorta as the part of the aorta. Like we have the ascending aorta, the aortic arch, the descending aorta, and the abdominal aorta. And now you understand why some books refer to 4 parts, some refer to 3 parts, and so on. One of the very important thing to discuss today is the branches of aortic arch. The branches of aortic arch. We have said we have aortic arch, which is happening at the level of the sternal angle of Louis, and then we are going to see the branches of aortic arch. The aortic arch has got 3 main branches. The very first branch is called the brachiocephalic artery, or the brachiocephalic trunk. Sometimes it's referred to trunk, some books refer to artery, but at least you know that trunk is big and artery is moderate size. Why is it called the brachiocephalic? So this one, I've just highlighted this in red so that you can remember that it has got the brachial part and the cephalic part. There's brachiocephalic trunk, has got the brachial part and the cephalic part. The brachial part means it's going to supply the upper limb, and the cephalic part is going to supply the structures of the head and neck. The brachial part of the brachiocephalic trunk is actually the subclavian artery, right? So the subclavian artery is the branch on the right side. The right subclavian artery is a branch of the brachiocephalic artery, and because the brachiocephalic artery is going to supply 2 important regions, and the region number 1 is the brachium, means the upper limb, and the region number 2 is the cephalic region, which means the head and neck. The other branch of the brachiocephalic trunk will be called the right carotid artery. The right carotid artery is actually going to supply the structures of head and neck. In summary, we have said we have aortic arch. The aortic arch has got 3 main branches. The very first branch is called the brachiocephalic trunk, or the brachiocephalic artery, and the brachiocephalic trunk or artery is going to supply the structures of the head and neck and the upper limb. The upper limb will be supplied by a branch of the brachiocephalic trunk, which is called the right subclavian artery, but the structures on the right side of the body of the head and neck will be supplied by the right carotid artery. Okay, on the left side is actually strange because the carotid artery and the subclavian artery on the left side, they arise directly from the aortic arch. From the aortic arch, you have left carotid artery and the left subclavian artery. They are coming directly from the arch of aorta, and that is a very, very important point to note. That is very, very important point to note. So we do not have a brachiocephalic artery on the left side. We only have one brachiocephalic artery, and it's called the brachiocephalic artery or trunk. So if in an exam you mention, you pick the right brachiocephalic artery or left brachiocephalic artery or trunk, you are wrong, because you do not have right and left. You only have one trunk, and that is the very first branch of the aortic arch. But on the other end of it, as we have seen, on the left and right side, on the left side, the left subclavian and the left carotid artery, they arise directly from the aortic arch. We discuss as well. We have a separate discussion on the subclavian artery and the branches. Don't worry about the subclavian artery at this moment, but the carotid artery will be covered when you're doing the head and neck. Okay, let's go back into superior vena cava. So the superior vena cava is carrying blood, deoxygenated blood from the upper part of the body. What have we referred this upper part of the body? We've said the upper limbs, and head and neck. So it should have veins that are draining the arms, the upper limb, and it should have the veins that are draining the upper part of the body, the head and neck, right? While we had only one brachiocephalic artery, we actually have two brachiocephalic veins, and in fact, the superior vena cava is made up of the combination of two brachiocephalic veins, one from the left and one from the right. So this is the right brachiocephalic veins, and this is the left brachiocephalic veins. We have two brachiocephalic veins, but one brachiocephalic trunk or artery. And because it's a brachiocephalic, same rule, it has the brachial part, and the brachial part of the brachiocephalic vein is actually contributed by the subclavian vein. Remember, we said the axillary vein will drain into subclavian vein, and now we are connecting that the subclavian vein is actually draining into the brachiocephalic vein, and the two brachiocephalic veins are combined to form the superior vena cava, and now they are emptying to the heart. We will not discuss, and then, okay. So that's the subclavian vein. The other vein that is draining the upper part of the body is called actually the internal jugular vein. The internal jugular vein is draining the head and neck. This is to say the brachiocephalic vein is actually a union of the subclavian vein and the internal jugular vein. The internal jugular vein on the other side, the internal jugular vein and subclavian vein will combine with combine to form another vein, which is called the brachiocephalic vein on the other side. But because of this internal jugular vein, we also have the external jugular vein. And the external jugular vein, instead of draining, it drains into subclavian vein. Sorry, we discuss it next time when we read the structures of the head and neck. All right, guys, this is what I had for you today. But as always, if you have a question, addition, or comment, you can always put your thoughts in the comment section. But don't forget to like this video and subscribe if you haven't. I have a TikTok channel and Instagram that I usually post useful concepts and material and some other funny facts. Don't forget to follow and keep in touch. All right, see you next time.